Welcome to the Family Development Center's COVID-19 Reopening Plan and Risk Management Overview. We want to welcome all of our FDC staff. During the stay-at-home order, we received the pleasure of getting a few pictures that some of our staff took with their children. It seemed that although we were under unusual circumstances, many took advantage and celebrated the togetherness of their family. We are glad to see everyone back. Throughout this training video, we will discuss the guidance and licensing standards we followed to create the protocols. We will discuss how we will help each other through this. We will discuss the daily health screening process, hand washing and the use of hand sanitizer, the increased cleaning and disinfecting protocols, PPE, personal protective equipment, maintaining of groups, classroom activities and meal service, the process of isolating a sick child, and what we will do in the case that we have a suspected or confirmed case of COVID-19 among children and/or staff. We will also discuss what home base and how we are supporting our families not yet in center base. Here are a few links of the guidance that we received in order to create our protocols. As you may all know, the Centers of Disease and Control provided guidance for child care programs first. Then the Illinois Department of Public Health published their guidance based on the CDC's guidance. Next, DCFS implemented some of their changes and shared in 2 separate occasions. Lastly, the Illinois State Board of Education created their guidance for reopening schools. The last link on here that I haven't mentioned is Caring for Our Children. It is a resource on how centers deal with health and safety. What was best practice before is now required. Did you know that we were all preparing for a reopening day since we mandated the stay-at-home order on March 17? We've been working remotely from home and still connecting with families. We instantly initiated our food service distribution. We had classroom staff visit their classrooms during the closure to start the process of removing certain items. We had staff complete trainings online, which included the bloodborne pathogens, bug busting and early childhood education, coronavirus prevention, as well as multiple mental health sessions to support families and most importantly you. Please know that this is a new process for everyone. We will adapt as needed. How do we implement these new and enhanced protocols with young children? Most importantly, when we decided to complete our reopening plan, we decided to have, as much as we could, continuity of care by purposely putting children in certain classrooms with their primary teacher, or perhaps putting children with a parent that is also a teacher. We've continued to communicate with our parents about the reopening plan, about our new protocols as well. We created an acknowledgement form so that parents were made aware prior to bringing their child of the differences in protocols. We instantly resumed routines. Children and adults thrive on routines. We know to expect tough transitions, not only for children, but for yourselves, for administrators, and for parents. It is okay to feel sad, mad, worried, nervous, excited, happy. As I mentioned, We have been continuing to communicate with families. The 2020 exclusion criteria and COVID-19 agreement provides the changes and how parents are being held accountable. We ask that families keep children home when their child is sick. We're asking parents to communicate when there is a suspected or confirmed case of COVID within their household. We're asking parents to acknowledge that we are changing our operating hours. In addition, teachers have touched base with families returning to center base. We've sent multiple remind messages to families. Many teachers and staff have video chatted with their families, sending them pics of the staff wearing their masks so that children wouldn't be nervous approaching. We've asked parents to update their emergency contact information. We have also updated any changes in regards to children returning to center base. Changes made must be notified, must be communicated to health service director, in particular food allergies. We do serve infants and toddlers, and we know that infants require lots of physical touch, holding, comforting, picking up, diapering, and overall feeling supported and safe. We ask that our infant toddler teachers take additional precautions. We've provided smocks for all staff members, and all adults entering the infant toddler classrooms must wear a smock. We also ask that staff consider wearing long sleeve shirts, keeping their hair up, washing their hands frequently, and helping children wash their hands frequently. Talk to parents about the importance of health and safety practices at home. Let's go over our daily health screening. Prior to COVID-19, we provided daily health screenings only to children in the classrooms, and never did we take their temperature. Now we're implementing health screenings for all adults, children entering the FDC, regardless of time. Children will be welcomed each morning by FDC personnel at the main entrance vestibule. We will take their temperature. We will ask a set of screening questions. Parents must be honest, and so should staff. Staff should not come to work if they have concerns regarding illness and are experiencing COVID-like symptoms. They must contact their supervisor immediately. At each station, we will have hand sanitizer readily available. We have also placed hand sanitizer throughout the building. All health screening documentation will be noted on the health screening forms. Health screening forms will be saved for 12 months. Once the child has completed the health screening, the parents will walk their child towards the indicated atrium. The personnel completing the health screening will walkie-talkie to the receiving classroom or program that the child has arrived, and should have a staff member meet the parent outside of the classroom so that the child can change their shoes. Parents should not be let into the classrooms. Children will change their shoes to their center shoes that are left here and cleaned and disinfected each day. Parents know to allow ample time to complete the entire drop-off process. At pickup, the adult will also be screened once more by getting their temperature taken. The FDC personnel completing the health screening will announce that the parent is here to pick up designated child. Once again, FDC staff will meet the parent outside of the classroom nearest the atrium door and change the child's shoes from the center shoes to their home shoes. Hand washing has always been an important part of our programming. There are certain times that children and staff must wash their hands. But now we are allowing alcohol-based hand sanitizer to be used by staff or preschool or school-age children. Children under 3 will not be able to use hand sanitizer. Hand sanitizer is placed throughout the building. Hand sanitizer is also located in each classroom and inside your first aid bags. Be sure that you apply the hand sanitizer properly on yourselves and assist children when they have to apply hand sanitizer. Hand sanitizer does not replace hand washing. As soon as a hand washing station is available, you must wash your hands. On this slide is a link to a video on how to properly apply hand sanitizer. Be sure that all hand washing stations in your classroom have the proper hand washing poster that illustrates the proper way of washing one's hands. Assist children who are unable to wash their hands properly. Cleaning and disinfecting. Once again, cleaning and disinfecting has always been part of our programming. Now we are using a new product. We have chosen to use a TB-side disinfectant that has been approved by the EPA and confirmed to kill coronavirus. We shall always store disinfecting and chemicals outside of the reach of children. Each classroom should ensure that they have plenty of choice to rotate. As children are done using a particular toy or activity, it must be placed in a bucket or in an area to be cleaned, which is to physically remove dirt and debris, sticky film by washing and wiping with soapy water. Then it shall be disinfected with the TB side. You can wipe down toys with a rag and water after it has sat with the TB side disinfectant for at least 2 minutes. We cannot use vinegar and bleach products in the classroom. Please know that chemicals may react when they are mixed. Do not have bleach or vinegar in your classroom or other cleaning products not approved. Be sure to reduce clutter on your surfaces, making it easier to clean and disinfect them. Again, limit the toys that are out. Be sure you have enough to rotate. If you are wondering in regards to our building service workers' enhanced cleaning and disinfection protocols, please visit the GSU emergency website link. There is a schedule regarding cleaning and disinfecting. Classroom staff, again, will be provided with the TB side disinfectant. Additional disinfectant is located in room 110 near the front office. Please be sure to use the inventory form to complete and sign out disinfectant and or other PPE. Building service workers will also clean and disinfect classrooms and frequently touch surfaces throughout the building at specific times. Classroom staff will also clean and disinfect frequently touch places within their classrooms, such as door handles. Be sure to follow the cleaning and disinfecting checklist located in your classroom. Initial off all tasks. Front office personnel also have a cleaning and disinfecting checklist. Kitchen personnel also have a cleaning and disinfecting checklist. We are all doing our part in order to support and prevent spreading any illness, not just COVID. Let's discuss PPE, personal protective equipment. In the past, we have always used gloves when performing certain tasks. Food personnel would use gloves. Staff during meal service would use gloves. During the diapering process, gloves are required. During the cleaning and disinfecting, gloves were required. and they still are. But in addition, we must all wear a face mask. In addition, we have also purchased smocks. Each staff member will receive smocks that shall be laundered at the FDC twice a week. Classroom staff have been given a laundry schedule. Please be sure to follow your schedule. The smock helps create a barrier between your personal shirt and your body and the child. As we know, children do need physical attention at certain times. If your smock becomes soiled, please change into another smock. If you have to use the washroom, please remove your smock. Remove your smock when going on breaks. Information has also been provided on how to properly wear a face mask. Information has also been provided on how to properly wear and take off gloves. A glove supply is located in each observation room for infants and toddlers and preschool and school age. Additional supplies are located in room 110. The Health Services Director also has an emergency supply of gloves. Our Office Support Specialist and Center Director work together to ensure enough supplies are provided and ordered. Let's talk a little bit more about face masks. Face masks must be worn in hallways when entering and exiting the FDC. Face masks must be worn in all classrooms for all staff, visitors, and children. They are required during food service operations. Infants and toddlers under the age of 2 will be encouraged to infants and toddlers over the age of 2 will be encouraged to wear face masks. Children transitioning to a preschool classroom should also start wearing a face mask because children 3 and older and in school age must wear face masks. During outdoor play, face coverings are optional as long as social distancing is practiced. Staff can choose to keep their face mask on, especially when children are approaching them quite frequently, even outside. When wearing a face mask, you must make sure it's covering your mouth and nose and it fits snugly. The FDC has a supply of adult and pediatric face masks. Parents and visitors must also wear their face masks as they're approaching and walking through the FDC. Face coverings or face masks are not worn when children are eating, drinking, sleeping, and napping. During that time, strict and consistent physical distancing must be practiced. There are exceptions to wearing a face mask. As noted, children under 2, children who cannot safely and appropriately remove their face coverings, children with severe cognitive or respiratory impairments, children who wearing a face mask presents a potential choking or strangulation hazard. Also, children who may have a health diagnosis or intellectual impairment that enables them to wear a face mask. Individuals with medical conditions or disabilities. If at any point a parent shares that their child cannot wear a face mask, they must contact their doctor to provide documentation for the reason. Health Services Director will work with the family to possibly offer a face shield in lieu of a face mask. It is vital that children who are unable to wear a face mask must have documentation from their doctor. It is not a choice. Again, the Health Services Director will work with families in the instances that families state their child cannot wear a face mask. As noted, PPE, personal protective equipment, such as face masks for pediatrics and adults, smocks, are located in room 110. The TB-side disinfectant is also located in room 110. Shoe covers are also located in room 110. The health services director will be responsible for keeping inventory of those specific items. All other items, including gloves, will be monitored by the office support specialist and ordered by the center director. How do we support social distancing in an early childhood education setting? We will be utilizing all available space. We must place cots and cribs 6 feet apart, facing children head to toe during nap time. Staff will create lesson plans and arrange activities to support social distancing. Having children spread out throughout the classroom is a must. As noted, do not allow clutter. Be sure you have a good rotation system so that toys and activities are clean and disinfected. Rearrange furniture if needed to support social distancing. Use visuals. Model social distancing for children. Review the social stories. Give frequent reminders to children. This is new for children and staff, so constant reminders helps children understand the new processes. Send home tip sheets to parents regarding social distancing. And offer more activities to provide solo play, such as drawing, coloring, cutting, and other manipulatives. Stagger indoor and outdoor playtime. When the weather is favorable, go outside. Have the children be in a space outdoors that promotes social distancing. Here are some visuals of what classrooms will look like. We have ordered and placed physical barriers to separate spaces, such as the preschool quad. We have children and staff wearing their mask in the classroom at all times. This includes infants and toddlers classrooms. In particular, infants are not able to wear face masks, so it is most vital that staff do. We have also designated lounges to our programs. The art room is now the infant toddler lounge. The former lounge staff room is only for the use of preschool classroom staff and school-age classroom staff. All other personnel who have a designated workspace, such as an office, must have and take their break in their designated workspace. We also have partitions that preschool and school-age classrooms are using. Again, we promote outdoor play. We ask that administrators and supervisors not meet in a room. Take advantage of virtual Zoom meetings. Plan in advance to avoid meeting in a room. Here are additional examples of partitions. As always, we adapt as time goes by. We may be purchasing additional partitions, and you have seen partitions displayed throughout the center. Please practice social distancing, even when there is a partition in place, to ensure that the children are not around during that time. Again, creating these cohorts will support during the time that any staff member or child become ill and the need to quarantine is present. Things have changed. We are also, as stated, not allowing staff to go into other classrooms they are not assigned to. This includes administrators. Although we love going in and saying hello to children and staff, this is no longer allowed. Administrators will only come into classrooms when necessary. Please be sure to contact the DoD for all emergencies. Activities and meal service. Classrooms shall be arranged in ways to support social distancing. We discussed this prior. Toothbrushing will not take place in the classrooms at this time. Instead, we will continue to support oral health at home. Children have received an oral health goodie bag, which has a toothbrush, toothpaste, and oral health handout. When families request additional supplies, we will provide. We have modified our family-style dining. Food service personnel will cover all bowls and bag utensils. Water pitchers will be provided daily and as needed due to the fact that our fountains are closed. Classroom staff will pre-plate each child's plate. And when seconds are needed, we will use disposables for each child. We will continue to provide a happy eating environment. For additional information on meal service, please review the CACFP training video. It is important that we teach, model, and reinforce health hygiene habits. Explain to the children why it is not healthy to share their drinks or food with others. Practice frequent hand washing and help children by singing a song or counting to 20. Be sure to teach children to use or wipe their nose correctly. Cough into their elbow. Let's discuss isolating a sick child. If a child develops any illness throughout the day, the following steps will be taken. If age appropriate, the child can sit and wait for their parent to pick up in room 145, which is the health services director. The health services director or administrator or extra staff will stay in that room with that child and be sure to wear PPE. Gloves, face mask, face shield, and a gown. If the room is unavailable or the child is too young to sit in the health services director's office, a designated area will be identified, most likely in another classroom, not in use. Be sure to place the child on a cot without a bed sheet or a cot sheet. Keep the child in one area. Parents have approximately 60 minutes to make arrangements to pick up their child, so the child should not be waiting too long. After the child leaves, be sure to open windows if the room has windows, notify BSW building service workers to clean and disinfect and follow their procedures. If a staff member starts to display symptoms throughout the day, they will contact their supervisor or director on duty and leave the center immediately. If child or staff member develop additional COVID symptoms, they must follow the required guidance. If a staff member or a child are displaying COVID-like symptoms, they must seek medical care. If it is determined that a test is required, the health service director and executive director will be notified. Staff members are required to complete the self-reporting form. Families must communicate with the family support specialist and the health service director the process that they're in regards to contacting a medical provider. The health services director, executive director, or administrator will contact the Will County Health Department by calling or emailing them. We will follow the guidance provided by the Will County Health Department. We will also follow all guidance provided by the Emergency Response Team of Governor State University. Administrators will work together to make the best determination necessary with the guidance provided and determine if closure is necessary and who would be considered a close contact and would need to quarantine. Information will be relayed to the FDC community by using Remind. The health alert notice will be sent providing signs and symptoms of COVID. If a child or staff member is diagnosed with COVID, he or she may not return to school until all three are met. The individual is fever-free without the use of fever-reducing medication for at least 72 hours. The individual is no longer showing symptoms, including cough. It has been at least 10 days since the onset of the individual's illness. A doctor's note may also be required by the health services director. A doctor's note may also be required by human resources. If the child or staff member has symptoms concerning COVID and subsequently is determined by a medical provider not likely to have COVID, the child or staff member may return to childcare if the following is met: no fever for 72 hours without the use of fever-reducing medication, a note from their medical provider documenting no clinical suspicion of COVID. Test results may also be requested. If it is determined that the FDC must close for any amount of time, thorough cleaning will be conducted and disinfecting. Building service workers and their supervisors may contact the outside vendor to make arrangements. We will close off any areas used by individuals with suspected or confirmed cases of COVID. All frequently visited areas by the individuals will also be cleaned and disinfected. See COVID Prevention Enhanced Cleaning and Disinfection Protocols. Here is additional information for GSU staff or students. In addition to the steps and the requirements in order if a staff member or student is suspected with COVID, they must also complete the self-reporting form. This form initiates the guidance provided by the emergency response team and human resources. In addition, a staff member must review the Families First Coronavirus Response Act. There is a request form to use benefits provided by the Families First Coronavirus Response Act. The link is provided here. Let's talk about how we're servicing our home-based families and how do we continue to support families not in center base. Currently, in-person home visiting sessions have been suspended. Home visitors are scheduling virtual home visiting sessions with their families. They're sending and dropping off materials. They're having constant contact with their families. Early Head Start families are being contacted also via phone, email, and virtually, especially if interested in enrolling in center base. Recruitment is still happening. Family support specialists are finding innovative ways to provide and receive enrollment documentation. It is vital and crucial that we continue to recruit and enroll families to support our program funding. The risk management plan provides an overview of many emergency response procedures. In particular, the COVID reopening protocols have been added to the risk management plan. The risk management plan identifies potential operational risks. It specifies ways to reduce or eliminate risks and what the procedures are in the event of an emergency or crisis. It is your responsibility to familiarize yourself with it. Each staff member should receive a risk management plan provided by the center director. Each classroom must have a hard copy of the risk management plan. If you cannot find a copy, please see the center director. It is important that during this time you start to build a resource kit. Here are a few different links. There is a link to a video from Sesame Street on how to provide self-hugs since we are supporting social distancing. There is information on transition tips for reopening for infants and toddlers. There is an engaging video for kids on washing hands. In addition, there is a link for testing sites for families and staff. There is an engaging video on wearing a mask for children as well as social distancing for children.